Hello, in this video we are going to talk about non-steroidal anti-inflammatory drugs, also known as NSAIDs. The most used drugs by the public. NSAIDs have three major therapeutic actions: anti-inflammatory, analgesic effects, and antipyretic effects. Okay, let's see what happens during inflammation. During inflammation, free arachidonic acid is released from tissue phospholipids by the action of phospholipase A2. There are two major pathways in the synthesis of eicosanoids from arachidonic acids. We have cyclooxygenase pathways and 5 lipoxygenase pathways. There are two related isoforms of cyclooxygenase enzyme. We have COX-1 and COX-2. COX-1 is responsible for physiological production of prostanoids and regulate normal cellular process such as gastric protection, kidney functions, and platelet aggregation. COX-2 causes the elevation of production of prostanoid that occurs inside of inflammation and chronic disease. Then let's talk about the mechanism of NSAIDs. NSAIDs act primarily by inhibiting the cyclooxygenase enzyme that catalyzes the first step in prostanoid biosynthesis. This leads to decreased prostaglandin synthesis with both beneficial and unwanted effects. Okay, note that differences in safety and efficacy of the NSAIDs may be explained by relativity for COX-1 or COX-2 enzyme. Inhibition of COX-2 is thought to lead to the anti-inflammatory and analgesic actions of NSAIDs, where inhibition of COX-1 is responsible for prevention of cardiovascular events. Based on selectivity of COX enzymes, NSAIDs can be divided into three. Selective COX-1 inhibitors, they are ketorolac, fluprophen, ketoprofen, indomethacin, and low-dose aspirin. Selective COX-2 inhibitors, they are naproxen, ibuprofen, piroxicam, and diflunisal. And finally, we have non-selective COX inhibitor. Non-selective COX inhibitor, they are meloxicam, diclofenac, celecoxib, and etodolac. Thank you for watching and see you in the next video.